Hello, everyone, and welcome to our May 1st COVID-19 news conference with the mayor and other selected guests. We'll hand it to you, Mayor Sheevey.
All right, thank you so much. Okay, and also I want to remind people that the press is not in the room and everyone is practicing social distancing. I think that's important to know. Please bear with me. Many of you that know me personally know that I hate to follow scripts. My comms team, I know they get a little irritated with me, but I kind of like to speak off the cuff, so I'm going to ask everyone to help me get through this and be patient. I want to start off by saying thank you so much to our experts in the room. I'm greatly appreciative of you being here to help me assist. I want to say thank you so much to the community. I cannot begin to tell you how grateful I am. I know it's been incredibly hard. It has been something that none of us ever expected or ever are prepared for. But I want to say thank you so much to this incredible community for helping us flatten the curve. I want to remind people 6 weeks ago when we closed down, we were looking at graphs that literally looked at, we could be losing lives of hundreds, if not thousands. And that is across the country and across the world, quite frankly. This virus certainly, none of us are immune to it. So I want to say thank you so much because it's been so hard on so many of us, our businesses, our families, our children. And so I want to express my deepest gratitude for all of you who have stayed home, practiced social distancing, and helped us get through it. You have done a tremendous job. I couldn't be more grateful, to be honest with you. It is because of your hard work that we have saved hundreds, if not thousands of lives. So I need you to know that. I also want to express my sincere condolences to the families of those who have lost loved ones from COVID-19. It is an incredibly cruel virus, and no one should ever have to say goodbye to a loved one via FaceTime. I mean, it's unimaginable. So I want you to know your city stands with you. We love you. You are in our hearts and our prayers. And if you don't have your health, you have nothing. So with that, I think health is incredibly important, and we need to talk about that. And that's why I am urging you to please go to your doctors, your dentists, seek medical care. Many of you have been putting it off, and it is an essential service. Matter of fact, I've been delaying it for 6 weeks. I need to go, so I'm going to go. I'm going to get out there. I'm going to ask you to please. It is a safe environment, probably the safest you can find in the city, to be quite honest with you. But I need you to go out there and get medical treatment. Call your doctors. Some closed at their own will, and they did this, just out of their own practice. So I want you to call them, see if they're open. Politicians should not be telling you how to seek health care. Your doctor can tell you what you need. And if you don't seek that health care, it can be actually quite deadly. So I need you to do that. Not to mention when you hold off, it becomes much more expensive and much more dire. I have someone here with me that I would like to make sure that he makes some remarks because we're lucky to have him on the COVID committee, and that is Dr. Fry. So I'm going to send it over to you, Dr. Fry. And the reason I'm doing that is Dr. Fry is on the front lines in the ER at Renown, and we're really grateful you're there. So I'd love you to speak about sort of what you're experiencing, why people need to come into the ERs, because I've heard people saying, I've gotten so sick and I don't want to go to the ER. And people need to know that's what they're there for. We're encouraging you to go. I think on some level, we've been telling people stay home, and they might have gotten the message, to a little too far to the right in that sense. But medical care is essential. So I'm going to send it to you, Dr. Fry. Thank you so much for being here.
Thank you, Mayor Sheevey. Appreciate the introduction. Yes, indeed, we've seen nationally and locally many folks avoid, unfortunately, emergency and hospital care with serious medical issues for fear of contracting coronavirus, and this fear is legitimate. Their conditions often advance as they stay at home, and this is because they feel that the hospital is an unsafe environment, that it's not clean. And these excessive delays, unfortunately and sadly, have led to many people dying, not from coronavirus, but from delays in surgical care, infectious care. And so please, I can't stress this enough, if you're out there with serious symptoms, don't hesitate to come and see us in the emergency department. If you can't, get a ride or you're unable to drive yourself and you have serious symptoms, please call 911. Feel comfortable. REMS is doing a great job on infection control, much like the hospital systems are. Again, to reassure folks that the environment of care in the emergency department and hospital floors are just unmatched. We clean to a very high standard. We're not overwhelmed. There's many people that ask me if we are, as systems in the area, overwhelmed in caring for folks with coronavirus. We are not only not overwhelmed, we have plenty of capacity, actually. And now is a very good time, if you have been putting your symptoms off that are more serious, to come and see us and be evaluated. I'd like to take the opportunity to say a little bit about mask usage, Mayor Sheevy.
Great, we love it.
I think we have an opportunity here today to really elevate the discussion of mask usage, distancing, hand washing, to a level of really being a badge of social responsibility. I think this is not just an important part of how we incrementally open, but it's really a cornerstone of how we stay open. I'd like to additionally commend the number of businesses that I've personally been in that have already gone to early measures on entry protocols, masks being mandatory to ensure the safety of their employees and their patrons. And I think they're just setting a great example for us all. And I think we should even Yelp them, if that's possible, Yelp them to call them out as to, just really doing a great job and setting a great example. I think we all recall the days of no shirt, no shoes, no service, and maybe we should add masks to that. I think we should all be comfortable with this new attire, this new normal, to further avoid economic disaster. I mean, we just have to, once we are open, we have to stay open. I think that's one of our main goals. Make this thing a fashion statement. These masks can be fun. We're seeing a lot of people, mix and match and color match, and I think it's been very, very fun to see what ingenuity people have. We need to, I think, have a whole lot more masks out there going forward. We're probably a bit short on masks, but I'll tell you, I think our town has always shown its fortitude and its ability to rise to the occasion, and I think there's a whole lot of people making masks already, and a whole lot more to come. And as Mark Twain once said, I think the secret to getting ahead is to get started. And I think we all should get started on our protocols, our mask usage, and really, be ready to not just open, but to, be in this for the long haul and stay open and stay safe and keep each other near and dear. Just one last thing on the education of our children, because I think we've all seen the impact to the community, and this is nationally as well, not just our community. Homeschooling has taken a toll on a lot of folks. Some of my partners are not just doctors, but homeschooling as well. And I know that this pandemic has placed extraordinary strains on folks at home. And I think we have an opportunity here as well, as we open up our city, to demonstrate the path forward to our children and with them by our deeds and actions. I think we should help them understand that they are as important and powerful as adults are in our mission to limit the spread of this illness. We cannot underestimate their value going forward. Finally, I think, again, this city has always been resilient. I've been here for decades, as many in the room have, and I'm so proud of my city, and I think this time is going to be no different. We're going to rise to the occasion. Let's open up our city safely, and let's keep our city open together. Thank you, Mayor.
All right, thank you so much. So incredibly well said. So I really appreciate it. And on the masks, I always say it's no time to be vain. I had a friend send me an article. Matter of fact, an Anton Novak from Rounds Bakery reminded me that they are in Vogue magazine, I think, this month. So there you go, girls. If you want to make a fashion statement, it's all there. I kind of alluded to that I have held off my health care. Like I said, I called my doctor. I'm going to go next week and get in to see him. But the other thing that I've been highly neglecting is a teeth cleaning, and I actually need a root canal, which that is not ever fun. So here with us, and I'm so grateful that you're here, because I would love to you, Dr. White, to speak on getting dental care. Thank you.
Thank you, Mayor Sheevy. I appreciate the opportunity to speak to you and the rest of our city here as we are excited to go ahead and begin our next stage. About 6 to 7 weeks ago, we went ahead and did our part as a profession to go ahead and proactively shut down and do our part to mitigate the spread of the COVID-19 crisis. And I think that for I can speak on behalf of the dentists in the state and of our city, we're really proud of ourselves. We're really proud how we went ahead and did our part, and we certainly appreciate the patience of our staff, of our patients, and now we look forward to our next step. As many of you know, the world of infection control, especially within dentistry, was something that was nothing new to us. We'd been highly engaged in it for 30 years, and so for us, this is something that, although we were familiar with it, this was something that we just needed to pivot and go ahead and go in a different direction. Although we were more used to the bloodborne pathogens, now we're talking about the aerosols within the different procedures that we have. And so pivoting, adjusting, being creative, and working collaboratively with the different dental family, we're eager to go ahead and provide a safe environment to presume dental treatments that's much needed within our city and our states. We're excited to go ahead and announce that we will be resuming dental treatment this Monday, May 4th, and joining 25 other states in the process. Some of these states had 5 times the number of active COVID cases, and so we were very excited that the politicians and the governor, as well as Director Whitley, had seen this urgency to go ahead and not allow our citizens to become more infected, more in pain, and more unhealthy. So I look forward to the future. I speak now to my staff, the staffs out there, and also the general public. The safety is our primary concern. We're always going to have to go ahead and understand fear. But we shouldn't allow fear to go ahead and keep us unhealthy or to get more unhealthy in the process. Safety is above all our main concern. And so if you're a staff member, we understand that there may be some concern on your part. And should you be offered your employment back and you don't feel comfortable, it is your right. And we stand by you that if you don't feel comfortable, then you have the choice to not return. As well as if you're a patient or you don't feel comfortable coming to the office. We're going to be doing outstanding pre-screenings prior to even coming to the office to determine whether you're a person that should be maybe hold off on the sides just a bit until we get through this a little bit further down the road. But we want to make you understand that we understand what you're feeling. And at this particular juncture, fear has consumed us. Whether we've been at home too long, on too many Zoom calls, or maybe you've just been on social media too much, it's hard to go ahead and always know what is factual information than just kind of some idle chitter-chatter in some of the groups. And so I think as we continue forward, making sure that we go ahead and communicate exceptionally with our staff, with our patients, and continually to update those folks as we go along, then we'll further go ahead and build back our community, our trust, and exactly where we want to be into the future. And so on behalf of the dentists, we welcome this new chapter for us, and we're excited to do our part to not only mitigate the spread of the disease, but also treat the citizens of the state and the city.
All right, thank you so much.
Thank you.
Very much appreciated. Not looking forward to getting a root canal, but we'll
Fair
get
enough.
through it. We'll get through it. But actually, no, I'll be happy to do so. There's something that I also want to touch on that I think is incredibly important right now is our senior care facilities right here at home. And we're seeing that they are becoming hotspots all across the country. And so I'm asking you to please understand that these facilities can be at high risk. And so we want to do whatever we can to help them. Half of the deaths in our community came from one senior care facility. And so we want people to understand the needs that they possibly have. I want to say thank you to Councilwoman Dura. She jumped in there with some of our community heroes like Bob Listner and ran right over and supplied them with masks and communication and first responders. She has done a tremendous job, and I'm so grateful for her work. And my entire council, to be honest with you, have done a tremendous job. Everyone sort of got a punch list. But I want to recognize her because she's done tremendous, and I'm so proud. But I think it's important to know that, you know, those facilities could use your help if you have PPE, things like that. And so I also want to say thank you to the state of Nevada because they are investigating because it's under their purview. And I believe they have, if you have any information, please call the state's ombudsman helpline. It's 1-888-282-1155. Again, that's the state's ombudsman helpline at 1-888-282-1155. There's also another very vulnerable population in our community that we cannot make sure that we do everything we can to help them, and that is our homeless population. Due to the health department's orders, they did not want any human contact to make sure that we did not spread the virus. So I want to make sure that people understand we didn't want to put anyone in harm's way when interacting with you know, anyone, to be quite frank. I mean, look at how we've changed our lives so much. I'm glad to say that our most teams, though, will be reaching back out to them to make sure they get the care and services they need. Many of us have been neglecting our care that we've needed, and we need to make sure that they have the same type of care. That is really, really important. But I'm going to make a plea because we cannot do this alone. In our city, we really have sort of outgrown some of our facilities to take care of our most vulnerable. And so I would ask everyone from our regional partners to our state and our governor to help us with those plans. I'm going to plead that they allow us to use the governor's bowl during this pandemic to help with these services and housing. We would also like to ask long-term that we would like to ask the state if we could use the old DMV building once they move out of that location. The DMV location would be ideal for us, and the reason why it's close to the NAMS campus and services. That's why we would make a plea to be able to use that facility. And this way, for me, it's really important that we're addressing mental health, addiction, homelessness, for our most vulnerable. And so the more facilities we have to do this, the better off we will be in our community. So I also want to recognize Councilwoman Jardin. She's on our CHAB board. Sitting to the left of me is Commissioner Bob Lucy. He's on the CHAB board. Both have been tremendous. Everyone on that board has been tremendous. I want to say thank you so much, Commissioner and Councilwoman Jardin, for all your help with services for our homeless. I mean, we couldn't do it without all of our regional partners and our state partners. And I know everyone wants to make this a huge priority. So thank you so much. Thank you, Bob. I want to send it over to, we're trying to figure out what to call you. You are our Chief City Manager. I think that's your new title. But I have Chief City Manager Jason Soto sitting to the left of me. I would love for you to talk a little bit about Clean and Safe Team and what you guys are doing to help our most vulnerable populations.
Thank you, Mayor Sheevy. You can call me Chief.
Okay,
You can
Chief.
still call me Chief Soto if you'd like. And I also have my RPD blue mask. I just wanted to show everybody this. I think of masks kind of like sports. I have to just say this real quick. You know, 100 years ago in all of our major sports that wear helmets, it was not a neat or a cool thing to do to wear. But they quickly realized that for their health, Every single major sport now wears helmets, and it's to protect everybody. Same thing with these masks. It's to protect everybody. So when I wear my mask, when you see me out in the community, when I'm wearing my mask, it's to protect you. I'm wearing it for all of you, our city of Reno. And thank you, Mayor, for bringing up our homeless population and some of the challenges that you spoke to. I certainly don't disagree that logistically we have outgrown some of the services that we provide, and that we have been working diligently as a region to address some of those issues. And I cannot thank the city of Sparks and Washoe County for all of their assistance for the past several years, really. I do want to talk about a couple of the things that we've done as the city of Reno in terms of addressing our homeless challenge. We outgrew the shelter where we were housing our homeless because we couldn't meet requirements for social distancing. So we opened up the Reno Event Center to allow them and put beds there. And this was, again, a regional effort to make sure that we had social distancing. And I have to say that we've been very successful in our efforts in preventing the spread of COVID-19 within our homeless population. And that is a huge, huge challenge that we all rose to the occasion, and we've primarily kept that community healthy, which is an important thing to keep our entire community healthy. We've done other things too as the city of Reno. I want to say probably 75 to 80% of our workforce is working from home. They're working remotely so as to not to contribute to the spread of COVID-19. And I know that a lot of our businesses, although they've been in these tremendous hardships, have done the same thing. So I really want to share a big thank you with our community. I know it's been tremendously difficult on everybody, and the steps that you took over the past 30 days have really led us to where we are today in terms of starting some of this reopening within our community. We do have teams that address our homeless challenges, our clean and safe team. It's a very important team to have because they really allow resources for our homeless population, and they also keep our city clean. All of those things are important, especially when you're talking about a time in which we spread disease. But as you stated at the beginning of this, Mayor Sheevy, the isolation piece for that homeless population was extremely important on the front end, and I think that's what's led us to be as successful as we are or have been. You mentioned the MOST team. They've been doing a fantastic job remotely, working case management and things like that with our vulnerable populations. I can't say enough about them. And really just this group effort. I've had the pleasure of working, and I've never really had the pleasure of working with the health department in the past. But I got to tell you, with such a small team, they've done such a tremendous job for this region, and under extreme conditions. I mean, they've been asked. There's been a lot that's been asked of them, and they've risen to the occasion. So, Chair Lucy and Mayor Sheevy, and everybody in this room, your leadership really speaks volumes. I know we still have a long way to go, but we're getting there. We're seeing success, we're seeing improvement, and I just appreciate everybody, and thank you for having me here today.
All right, thank you so much, Chief City Manager. Thank you. Really appreciate that. I know many of you have been probably watching the news and noticing some of the biggest rollouts across the country are mass testing initiatives. We know that that's a process that can really be sort of that step to economic recovery. So I have Chairman Bob Lucy here with me, and he can talk about that mass testing initiative, and certainly it was not easy to put in place. I'm excited about this, and I know that you probably haven't slept in over 2 weeks because I know how hard you've worked on this initiative. I want to say thank you so much, Mr. Lucy, because all of you up there have worked so hard. You've got Bob Layton, Sam Hicks, the health department, you've really kind of just made this possible. So can you
you.
talk about the mass testing initiative?
Absolutely.
And the goal is to test 1,000 people a day in our community.
Yes, ma'am. That is what we're going to do. And first, I want to thank you for having me here today to have those discussions with all of you. And it's a real honor to sit and come and participate in this discussion. You know, as we move into the new evolution of what our new normal looks like here in Northern Nevada, I think Chief Soto or Manager Soto said it best, is that, you know, previously when, you know, in sports, helmets were not the thing. But as we move into this new evolution, the masks and how we do social distancing is going to be paramount, and how we operate within our community. I can assure you, but a big portion of that is going to be how we continue to test widely amongst our citizens. As many of you understood and probably participated and watched last night, our governor addressed all of us talking about what the road to recovery looked like, what that would be, and how we would be able to reignite our city and our state. And I think the most important part of that is he really was adamant that we needed to get to a level of testing that we would be able to test through a good portion of our population, not just statewide, but within every community here in Nevada. And so as I want to thank, and as the mayor alluded to, I want to thank our incident command team. Chief Bob Layton has been up there as an emergency manager for Reno, has done a tremendous job. Incident commander Sam Hicks and his incident command team, the health department, all have been working day in and day out to develop the post. And really, that's really what we're calling it right now. And the only place that you can go get current COVID testing is really right now at the post, which is located at the health department down on Wells and 9th Street. Now, that post has been stand up and has been operating now over since January. And we have really been working on that continuously. We're up to date. We've nearly tested 10,000 individuals here in Washoe County. And that collectively represents about 2% of our population. What we really want to get to is about 10%. That represents about 100,000 individuals to really get a good, solid data set about how this COVID-19 coronavirus is affecting our community. And so when we see these types of things and we have these challenges, the biggest thing that I would ask for everybody to do is understand what the symptoms are. Go to the COVID website here on Reno, at reno.gov. You can go to Washoe County's website. You can go to COVID-19washoe.com to get those results as well. They will give you the information that you need to identify the symptoms, and then also the numbers that you should call if you are experiencing those symptoms to get scheduled and get down to find out if you are positive for COVID-19. And then we can start beginning the other process of contact tracing and identifying, because really what we've identified, as you've heard from the speakers here today, is that quarantine and safety procedures have been the best course of action to really controlling this. And as we move into that new normal, and as we continue to work on reopening our businesses and reigniting our healthcare and reigniting the way we do business, it's going to be important that those that are sick stay home. If you are sick, seek the treatment from your doctors, seek the treatment from the health department, get tested, and if we can provide you information and make sure that you're safely taken care of, we are going to do everything we can to make that a reality for you. This is going to expand over time. I was on a phone call this morning that the state lab will hopefully have capacity to do 1,000 tests a day as early as this weekend. But that also relies heavily upon the ability to collect those tests and how we move forward. We're working with the state diligently and the governor's office and the DEM team to make sure that those collection tests are available to us. And those new phases will be rolled out continuously. And I assure you, I know the mayor has been diligent about making sure that we're getting the information out to you in a timely manner, and we will continue to do so. And so as testing ramps up, we're going to focus on our frontline workers, our healthcare workers, our police officers, our firefighters, REMSA, all those that are helping us fight COVID-19. We're going to focus on them first and make sure that they have the ability to continue to fight this very vicious and faceless virus that we're fighting right now. But Another opportunity that we also see in the future, in the not too so distant future, is antibody testing. Now, the antibody testing is currently available. It is, you can get it through your healthcare provider. They can prescribe it, and you can go get it at a commercial laboratory such as Quest or LabCorp. They can issue those lab tests for you, but those things are costly, and so there are some challenges with that. But as those supply chains loosen up and as things start coming online, we will see some more antibody testing. Now, antibody testing is a little bit complicated. It doesn't necessarily show that you are immune to COVID-19 or not at this point, but it does show that whether or not you've been affected by it at some point. So as those things continue to evolve, we're working and relying on the expertise of Dr. Mark Pandori at the Nevada State Public Health Lab. He's been a tremendous asset to our state and to our region. As a Reno resident, that he assures me that his focus is here and will continue to be here and make sure that Northern Nevada and Nevada as a whole continues to get that focus. So that is where we are with testing, Madam Mayor, and
All right.
I'd like to.
Really appreciate it. Like I said, I'm grateful for all your hard work. Because you brought up antibody testing, I'm actually going to go to Dr. Fry for a minute because I would like you to touch on antibody testing, because my fear is, and you could correct me if I'm wrong, is that how accurate are they? And with that being said, if they only, you hear different numbers out there, if they're only 65% accurate, you want to be careful about people going out there and saying, hey, I got tested, I'm good to go now, right? And I'm safe. So I think, I'd like you to kind of weigh in on that and talk about sort of, what you think, what is in store with the antibody tests.
Thanks, Mayor Sheevy. Well, we are seeing antibody tests from a lot of different manufacturers in the marketplace. And to the public, I would say that conversations with your doctor about those specific tests and the manufacturers and their reported sensitivity and specificity is paramount. There's a lot of tests out there that aren't very good, frankly, but there are some that are quite good, and I think that it's important for patients in the discussion with their physicians to understand how to utilize a test result as well. What's the goal of doing the test? What is the goal of the positive result, and how that will affect their life and the lives of those around them? So the interpretation of the test is pretty important, even before you get the test, to understand why you're getting it and what you're going to do different as a result of that test. Again, Mr. Lucy said, importantly, that the tests are available more widely than ever now. But I don't think that people should necessarily rush to go out and get tested immediately unless they have purpose in that testing. There are a lot of reports now that say that a positive antibody test may not confirm immunity. And I'm glad you touched on this, because we're getting more reports that folks have internationally contracted the illness a second time. So we're not sure what a positive IgM or a positive IgG test means going forward. Does that confer partial immunity? Is that going to help us with herd immunity? Is that going to give us some level of durable immunity in our community, locally and internationally going forward? So a lot of questions that I think are important to discuss with your physician.
Right. And you don't quite know how long you would have that immunity. We still don't know. So there's so much that is unknown. I just worry. I want people to be very aware about those antibody tests, that they might not be that accurate. But as time goes on, and you've seen, while we've watched this pandemic, things have changed so rapidly, almost on a daily basis. So, I'm keeping my fingers crossed that everyone just keeps doing the great work. Speaking of work, I want to clarify, I had a company call me the other day, and actually it's kind of an exciting company. I did not know they were here. I'm very proud to have them. So Anne, you'll have to reel them into the chamber. But they are a company called Sure Clinical, and they did not know that they should be operating So we had a lengthy conversation. And actually what they do is they're providing free software to 4 clinical trials of the vaccine, of the COVID-19 vaccine. And they're providing that software for free to these companies that are working on these vaccines. So I want to give them a shout out because I think it's very cool to have something right here, homegrown. So, but the reason I bring that up is I wanted to just kind of give a rundown of the businesses that are that should be operating, because I think there might have been confusion with certain businesses, and I've had people say, well, I didn't know my veterinarian was open, or things like that. So I'm just going to run through those. I think those are really important. And then I'm going to have Ann talk about her brainchild, Curbside Commerce. So those services are healthcare services, business that sell or rent medical supplies, essential infrastructure operations like construction and manufacturing, agriculture and utilities, grocery stores, retailers that sell food items and other household essentials, restaurants offering meals via takeout, drive-through, curbside pickup, or delivery. Entities that provide food, shelter, or social services for vulnerable populations, businesses that ship or deliver goods directly to residences, licensed cannabis entities, delivery only, and I think they fall under curbside. We'll just have to clarify. Oh, they do. See, my experts here. That's why we have you. They do. Pet supply stores and animal shelters. I've had a lot of my animal enthusiasts, my animal friends, ask me about the pet shelters. So I want people to know your pet supply stores, your animal shelters, your veterinary services, veterinarian services. Bob Lucy knows that
Yeah,
one, that
very much so.
they're open. Financial institutions, pawnbrokers, hardware stores, and home improvement centers, auto supply, auto repair, and tire shops, laundromats and dry cleaners, warehouses and storage facilities, transportation services like taxis and rideshare, mail and shipping services, businesses that supply on a curbside pickup or delivery basis necessary for people to work from home, like office supplies and electronic stores. Plumbers, okay, that's a very essential service. I don't want anyone calling me that they haven't been seeking out their plumber, all right? Electricians, I don't want you in the dark either. Exterminators, home security, let's see, any similar service providers to security services, professional or technical services, childcare services, residential facilities and shelters, media services. Our media has been so important. I want to just thank our media. They have been tremendous throughout this. We could not message to our entire community if it wasn't for our media partners. Thank you. We're so lucky to have you. Lodging, gas stations, propane services. And if you are confused on what is essential, what isn't essential, please call the City of Reno 334-INFO. We can help you get that. It is also on the governor's website. There's a lot of information out there. So I was surprised at actually how many businesses, I asked them, I said, well, did you read the directive? And they were actually on the list. So I want to make sure that people know if they are or are not on that list. So at this time, I would love to call upon Ann Silver. I don't think you've been sleeping either.
No, not at all.
We were on a phone call with 700 of your members, and I've been calling you at 7 o'clock at night.
Yes.
And I have just thoroughly enjoyed our conversations, but your brainchild with Curbside Commerce and everything you're doing for our small businesses, because it is tough. It is really tough. Quite honestly, I don't know if I will be able to open my business back up. I honestly don't know what kind of world we'll live in moving forward. So I want to say thank you so much. I would love for you to talk about Curbside Commerce, my friend.
Sure, I am thrilled to. As of last evening, Governor Sisolak announced that many businesses that up till now have not been considered essential and have been shuttered can do curbside delivery, which means that consumers can drive up and purchase, or I should say, pick up the products they've purchased online. over the phone. There's no transaction that takes place through a car window. In fact, it's done through the trunk of your car or in the back of a truck. And I'm excited that that means thousands of small businesses that have been closed over the last 6 to 8 weeks can do some sort of commerce in our community by way of Curbside Commerce. It's been a long haul to get this program approved. I really appreciate your support, Mayor Sheevy, and Commissioner Lucy's, and certainly Governor Sisolak, who took a look at the program, made some revisions, but went forward with it, which gives our members and all the small businesses in our community ample opportunity to revive commerce, which we know is so important. And we know that a huge part of the identity of this community is small business. For the Chamber, 75% of our businesses are small businesses, and they have been closed unless they've been in the food service business or any of those that you mentioned. So it's exciting that it's now live, and I took a little walk before and found some that were doing curbside commerce, which does not mean that you can put a table out and put your crafts or products out for people to see and touch. It means that people order online, if you have an online presence. They order the product, they pay for it over the phone. The business gives you a designated time to drive up in a parking lot or at the curb, and you pick up that item. It is delivered by employees wearing masks and gloves because we want to keep workers safe. And it's, once again, placed in the car trunk or in the back of a vehicle. It is not meant to open up craft fairs or curbside tables for display. It's very much about purchasing online, but being able to give our small businesses a fighting chance. You know, we say kill the virus, not the economy. And so we are thrilled to kick the virus to the curb and let people do some business in this town. Very excited about that.
Thank you.
You're welcome.
Really appreciate it. I want to apologize. I was coughing because I actually accidentally just drank too much water and I started to choke. I'm fine. Because someone looked at me, you know, as we're doing these days, and so I just want you to know, yes, I drink way too much water. I was drinking it too fast. So thank you. Appreciate that. I want to talk a little bit about moving forward and what that looks like. We stood up something called the COVID Response Committee, and many cities across the country are doing this, and they bring stakeholders together and they bring people to the forefront, like our experts that we have here today, Dr. White, Dr. Fry. We have Dr. DeMiro. He was the chief medical officer under Governor Brian Sandoval. He has been tremendous, but we have brought these experts together to talk about what that looks like moving forward, because I want people to understand in cities, this has been really interesting because we're used to fires and floods. We're not used to, you know, these pandemics. This is something that none of us have probably ever seen before. So we're very prepared for that. So this committee is incredibly important, and we've had some wonderful elected leaders on there, Von Hartung, Christopher Dare, Naomi Dewar, so many people at the table, even a veterinarian. So I want to say thank you to our 3 doctors who are here in the room helping advise us. And that's one of the things we wanted to stand up this committee. So what does that look like moving forward? We thought that that was really important to have people at the table that could help make recommendations to our city council, to our regional partners, and quite frankly, we would love to be able to offer our input to the state as well. We think that that's important. And one of the things with this committee that we are looking at, we are going to ask our regional and our hospital healthcare partners and our health department to help us with data that we think can create a matrix that could be something that looks very much like, with that data, it would look very much like the pollen count or the burn code, and people would be able to take it and sort of look at what the risk is of COVID maybe in the community at that time. This would be obviously to our region, but if it were something to be successful, it'd be wonderful to share it with everyone, because I think it's important as the public, we look at that pollen count and we make those assumptions, or we make those decisions if we should be out and about, right? I know Rebecca Venus said to me, I don't go ride my bike in high pollen days, right? And I think this is important, and I'll tell you why. I'm immunocompromised. I take immunosuppressants, and So I have to be extra careful, just like our elderly population. So this committee is looking at doing a matrix like that, and it's a recommendation, and if it were to be something that could be effective, we would love to see something like that rolled out. But I'm fortunate to have experts at the table like Dr. White, Dr. Fry, Dr. DeMiro, and I want to say thank you to Dr. DeMiro. I believe you are on the phone. We are glad to have you here. He is in Las Vegas. He did a lot. I got to know Dr. DeMiro when he was the chief medical officer. I would call him with questions. He was incredibly knowledgeable. We are so lucky to have him in the state of Nevada. He also did a lot of policy, a lot of laws on some of our the opioid epidemic here. He's incredibly passionate. Again, chief medical officer under Governor Brian Sandoval, so he's very, very capable, and he's added a lot to this community. So I would love to call on you, Dr. DeMiro, if you are on the phone.
Thank you, Mayor Sheevy. Can you hear me?
We can.
Okay, excellent. Well, thank you. I appreciate it, and I apologize for not being available in person today, but I do want to thank you for putting together such a great task force on COVID-19. I really think it gives our city an advantage over many other cities when we have been able to engage a very diverse array of people who can provide input for the task force. I have a unique perspective here, being both a small business owner and a physician, and I believe that your actions have helped to flatten the curve tremendously in our community. What's very interesting is from the data that we're seeing and that we reviewed at the task force, we've really been able to flatten the curve, and many of our medical facilities are underwhelmed, as Dr. Fry was discussing. So, one of the things that I wanted to discuss was, in medicine, there's a concept called Occam's razor, and it loosely means the simplest solution is usually the best solution. And it really boils down to two questions, as I see it, which is, what medical resource capacity does our local healthcare system have in dealing with a crisis at any point in time? And number two, what's the impact of COVID-19 locally on our healthcare system? So at the center of our healthcare system is the ability for us to react to sudden surges and outbreaks of both known and unknown diseases and trauma. And the task force really thinks that the availability of beds and testing, as mentioned earlier, is really critical in maintaining order and isolating these outbreaks. And I think everyone feels here, as we see the news developing, that the future in disease tracking will likely center around contact tracing and targeted healthy quarantines. Our task force decided, as you mentioned before, to concentrate our efforts on creating a unique metric for adequately identifying community medical resource availability for not only the COVID-19 crisis, but for other issues that could quickly overwhelm our healthcare system. So the task force is very excited to collaborate with our physician colleagues, hospital partners, Washoe County Health District, and government officials. And the goal is really to empower individuals. We want to provide our citizens with a reasonable and quantifiable metric to make decisions for themselves and their families. So thank you for putting all this together. I wanted to keep my comments brief, but thank you, Mayor Sheevy, for putting this all together, and I'd like to hand it back to you.
Thank you so much. I really appreciate you being on the phone. I know we tried to get you into Zoom, and you're probably sick of Zoom. So there you go. We gave you a little rest. But thank you, Dr. DeMiro. We look forward to working with you. Thank you so very much. You've been tremendous. Okay, here's the tough part. And, being a politician, you're supposed to be good at this, and you're supposed to be good at asking for money and contributions. I am not good at it. If you know me, you know how I hate to raise money during campaign season. I absolutely hate it. I get in trouble that I'm not making call time. I will do everything in my power to not ask people for money because it feels so uncomfortable. It doesn't feel right. It's awkward. It's terrible. So I hate it. But this is a time if I'm going to ask this community for anything, and I'm talking about our large businesses that haven't been impacted by this virus like so many small businesses have and so many people that are on unemployment. This is a humanitarian issue. I desperately, desperately need your help. I receive phone calls every single day about people not receiving their unemployment benefits. I am asking, I'm imploring this community, our big businesses, we are so lucky to have you in this community, but this is the time that I need you the most. I need you the most. I need Tesla, I need Amazon, I need Apple, I need our large construction companies. I need you now, now more than ever. If you can donate to this crisis through the city of Reno. You can reach out to me at mayor@reno.gov. It's that easy, but we want to put money in the hands of people who desperately need it right now. There are people that barely can put food on the table. Not only that, are barely paying their rent. I want people to understand this is a dire situation for so many. So I'm begging you, if you can donate anything to this cause, this is the one time that I will plea and ask you for any donations that you could possibly give. And we're trying to figure out a system that we could get them into the right hands of people that haven't received that unemployment, those 1099ers. I mean, those are the smallest businesses from our hairdressers to our manicurists. I hear all about them. And I say, wear these dark roots with a badge of honor, girls, because it's been tough and painful. It's been painful. And so we're all looking forward to when you get open. But at this time, I got to tell you, we need help in this community. We need your help. So if you are a business that can do so, I mean, I don't even care. I'd be grateful for $5 because there's so many people out there that don't even have that right now. So again, if you are out there, please do whatever you can to contact the city, and we will do whatever we can. I want to say thank you to Councilman Reese. He's been on the phone actually doing some of that heavy lifting because he knows how I cringe to ask for money. But this effort is certainly worth it. So my Vice Mayor, Devin Reese, thank you so much for all your hard work. And I think you said you spoke with Bob Listener from Lifestyle Homes, who is one of our biggest heroes in the community. I love that man. He just does a tremendous job. And he stepped up to the plate. And so I'm asking all the other big businesses in town, if you could make a match, that would be absolutely tremendous. Vice Mayor Reese and I would be grateful. I know this entire city would be grateful. So I want to make sure we ask for that. We need that. And just to wrap things up, I want to say thank you to my entire city council. You guys have been incredible. I've given you all a punch list. You have been out there getting it done. I know in politics sometimes we have different ideologies and things, but this has really showed me that we can come together. So some of you that ever might read about our differences in the community, this has really proven to me that we work as a team, we are one, and I'm very proud of that. So I want to say thank you so much to Bonnie Weber, Naomi Dewar, Devin Reese, Jenny Breckus, Oscar Delgado, Neoma Jardin for being incredible over the last 6 weeks. I am just incredibly grateful. I want to say thank you to our regional partners. Chairman, you seem to be the chairman a lot. And so our Chairman Bob Lucy and Vaughn Hartung, he's done a tremendous job working with me and been on the COVID committee. So I want to say, thank you to all of our regional partners over there, and Bob Layton and Sam Hicks. And I'm so glad that you talked and touched on them because, I call Bobby up all the time and I'm like, oh my God, what are we doing? Help me. And so he's really kept me very calm. So those guys have been fantastic. And there's so much work going behind the scenes that people in our community don't get to see. But I just have to tell you, I am so impressed and so proud. I was born and raised in this city, and I couldn't ask for anything better. I want to thank our partners at the City of Sparks. Ron and I have, Mayor Smith and I have spoken a few times, and he's self-isolating at home, and so he's the perfect model, so everyone can follow Mayor Smith. So know he's doing great work as well, and all of our city council over in Sparks, our sister city. And lastly, I think it's important, we want to thank you, our community, from our grocery store clerks to our physicians to our front lines. It's because of you, It is because of you that we have had this type of success. And I'm not saying that this is over. I don't want people to think that it is. It's going to be a very, very long road. So I'm asking you to have grace and mercy for one another, because we never know sort of what people are faced with and what they're going through. This is a tough time on everyone. We've all been on edge, right? And I don't think, like I said, none of us are immune. So I just always keep saying, spread kindness, not the virus. Spread kindness, not the virus. So with that, lastly, I would be remiss if I didn't mention all the hard working people here at the City of Reno. It's been tough on them. I don't think any of them have slept in 6 weeks. They are just doing a tremendous job. Rebecca Venus, you have been just a rock. John Humbert, a rock. You guys are just, Matt, I think you're over here, you're a rock. I can't begin to tell you how proud I am. And they tell you never to call out names because you're going to miss someone, and then you're really going to feel guilty. That's what I'm going to do tonight. I'm going to go, oh, I should have mentioned, so-and-so, because they're so important. And so I apologize if I left you out, but I need you to know I am so grateful for your help and for giving back to so much of the city. Again, like I said, there are people behind the scenes that you don't get to truly see every day in their hard work, but I do. And as a mayor, I just couldn't be more grateful. So anyway, all I want to say is God bless Reno and God bless all of you. Thank you so much for tuning in today. And at this time, I am going to send it back to you, John Humbert, for any questions from the media.
You bet, and we'll continue to do what we've done in the past, and we'll go down the list, and we'll start with Bob Conrad.
Oh, Bob, are you there?
Can you hear me?
I can.
I actually have no questions. I'm just listening, but thank you.
Okay, well, I'm glad you're on the phone. I do want you to speak a little bit about your mask, because I want people to know they don't have to run out and grab a mask. They can use a scarf, they can use a bandana, and Bob has another, you have another creative way. Can you tell us just a little bit about that?
Only because I'm on the spot now, but yeah, you can. I actually got a new mask the other day, so I've graduated by wearing underwear on my head. But yes, you can wear an underwear mask. There's videos on YouTube on how to do it. Men's underwear.
Well, that's good. Yeah, thanks, Bob.
Good to know.
Thank you, Bob. I appreciate it. I really do. Thanks.
With that, we'll go to Anjanette Damon.
Hi, Mayor. Thanks so much for taking some questions. I'm curious about this soliciting donations from the community. How exactly does that work? Can a local government accept?
So we're actually, I think,
donations?
it's go. Sorry, we're going.
Oh
through,
yeah, just how's that?
We're going through the community foundation because that's the way that it goes through a nonprofit. And again, we're just pleading if there are any large donors out there, like our large companies that can do anything to help.
Okay, so they should contact the community foundation?
They can, sure. And if they need any assistance, we'll direct them over there.
Okay, thank you.
We'll go to Bill Densler next.
Oh, hi, thanks. Really, I just want to thank Bob for clarifying what kind of underwear to use. I don't have any questions, Bill. Thanks.
Thanks.
It's a community service, Bill. Thank you.
Yeah.
We'll go to Riley Snyder.
Riley from the Nevada Independent.
Yes, hey Mayor, sorry, I was having some computer difficulties. I wanted to ask, I asked Mr. Lewis about this a little bit earlier today, but in terms of when Washoe County and the city of Reno moves into the phase one, that initial stage of business reopenings, the governor's directives, local counties and local governments go kind of below whatever the state is requiring. Do you foresee Washoe County doing anything substantially different as compared to Clark County or other neighboring counties in terms of what might be opened or what restrictions might be loosened in that phase one reopening process?
Mm-hmm. Well, thank you for that question. I think that it could look very different depending on that county or that city, based on numbers and data, they will look at that. That's why I think, a matrix could be something that might be useful, but I think it could look different. I don't really know. We're still under the governor's directive. And so we're all going to follow those guidelines, and he has given it to the county to make sort of those assessments. So, and I'm sure you've got a very talented commission, and you guys will do a fantastic job.
Yeah, and I think, Madam Mayor, like I said earlier today, and I'll continue to say, the county is committed to continuously working with the City of Reno and City of Sparks. We are going to go hand in hand as we move through this process. This is not going to be isolated to any one entity, and we're going to continue to make Reno and Sparks and Washoe County revitalize the way that we feel is a new normal and a safe normal for our community. Nothing that would impede our citizens, but also allow our businesses to continue to thrive again. And we're focused on that and really making sure that that's at the front of our thoughts and communicating that to the medical advisory team and the local empowerment advisory panel. So thank you, Madam Mayor.
And one thing I want to touch on so that everyone is extremely clear, this is really important. Our behavior is going to dictate what this future looks like for us. And that's why I cannot stress enough to people to keep the social distancing, wear your mask, do everything you can so we can keep those numbers low. And the lower we keep them, the more success obviously we will have. But I want to stress to that point that none of us want us to go back into our homes in September or October or things like that. So if we can all continue to stay diligent, work together, then we will get through this. But you're starting to see people talk about, is there a second wave? Could it be much more damaging? Things like that. And with that being said, I would just really stress this community is really, we are the only weapon that we have to this virus. That's it. It's us. So I just want to stress to people, let's do all we can so we are not having to make those difficult decisions, because it could be, if we started to see cases just get outrageous, right, then we might have to pull it back. So I want to be really clear to the community that that could be a possibility if we all don't continue to practice social distancing and taking every precaution. Okay, John.
We had a question via text and email from Channel 2 that while curbside commerce is happening and people can get physical goods or food, what about service industries and companies that are trying to take precautions to cut hair or do beard trims or things like that? What about those folks who are trying to do things right down the middle?
I'll take that
Yes, I would love
question
that.
and just say that as far as I know, as the head of the Chamber of Commerce, we've not been told that the governor has enabled hair salons or nail technicians to open their practices. It's just simply not safe enough. It may happen soon, but that was not included in his directive last evening regarding curbside commerce. I haven't thought about getting a haircut on the curb, but I don't think that's part of what we've been talking about when we talk about buying products from one of the established businesses here in town. I think you could buy the shampoo, you could buy the nail polish online and then go pick it up. But I don't believe that the governor's ready to open salons of any kind at this point in time.
All right, we'll go Kenzie Bales, or Kenzie Marjan, pardon me.
I'm good. Thank you, guys.
Thanks so much.
We'll go to Bree Zender now.
Hello?
Hi.
Can you hear me?
We can.
Oh, fantastic. Thanks for taking my question. Is either the city or the county considering an order or any sort of public campaign to up the use of face masks in public?
What did you say? I'm sorry.
Is either the city or the county considering any sort of order or public information campaign to up the use of face masks in public?
Well, we've certainly had a lot of those discussions. Anyone that knows me knows I'm a huge proponent of face masks. I think You have to be careful because you don't want people running out there and buying the N95 masks that our frontline so desperately need. So you have to message it really carefully and make sure, wear a face covering, right? And that is great for us normal folks going to the grocery store and just doing essential things. So we want to be very careful about that so that we don't get that message confused with other messages. And we also want to make sure that, businesses have the opportunity to really let their employees know if they would like them to wear masks and things like that. So we're coming up with those kinds of directives. Me personally, I would beg you to please wear a mask. And I think that the companies or the businesses that do that will have an economic advantage. Anna and I spoke about that. We really do. We think that if you're showing your customers that you are taking the extra mile, and some of you already do that and people might not know that, but if you show your customers you are going above and beyond, they will feel so much more comfortable in your establishments. So I think they are a very positive way to show, like Chief Soto said, a way to show, I'm wearing this for you. And I think that says a lot. I am wearing this for you. So, Chief Soto, do you want to jump in on that?
Yeah, I can just clarify. No, there's no order from the city of Reno or Washoe County, but we strongly suggest that you wear your masks when you go out. And really, I can make it pretty simple as to why we want to wear our masks while we're out in public. Because of the vulnerable populations, and I use an unfortunate situation that I'm very close to, somebody who's going through chemotherapy who has cancer. And how many people touched that person that had cancer? And I don't want to infect any of those people that are in this individual circle because I don't want to compromise their immune system. I know it's frustrating to wear a mask. I know it's not comfortable. I know it's hot. Makes my glasses fog up. But there's so many people that we don't know about that have compromised immune systems at this time. So we just strongly suggest that you wear a mask. If you don't have access to a mask, then we strongly suggest that you keep as much possible social distancing as you can. And that's how we become successful in our community.
Right. And I would just say there's a great resource online. It was a girl that's worked for me for a long time, and she is wonderful. And of course, we're out of business, but she got online right away and she started something, Masks Across Nevada, on Facebook. And they are happy to sew you a mask for free. And there's so many amazing seamstresses on that site, on that Facebook site, and they are all working 24/7 to provide masks just out in the community or whoever needs it. So that's what I love about Reno, is people come together. I wanted to say thank you, Danielle Pasquale, for doing that. You've done an amazing job. And they are doing great work. I mean, they've literally supplied thousands of masks to our community. So it's really impressive. Anne, I'm going to send it to you.
I just think there's somewhat of a moral imperative to wear a mask at this point. It's a show of good citizenship. Much like you wear a little pin or a sticky that says, I voted, I think a mask is now something to be proud of. Something that says, I care about my loved ones, I care about my fellow citizens, I care about my customers, I care about my employees. So I think whatever vanity or discomfort we may have, in the long run, these masks will become quite common, and I think we'll get to feel much more comfortable when we see everyone else in a mask.
Perfect, love it. Okay, John, back to you.
All right, final question is from Lucia from This Is Reno.
Hi, Lucia.
Hi. Hey, how are you doing? I just have a question. I was wondering if we could circle back really quickly to the antibody testing. This is the first time kind of hearing about it, so that is available for the public now. And can you talk about what that capacity looks like and how people get it and how much it costs?
Sure. I'm going to actually send it to Dr. Fry if you know anything about that. And I know that Commissioner Lucy, the Quest has it and others, right?
Yeah, so I'll actually kind of kick it off, and then I know Dr. Fry can help me with this. So the antibody testing is available. Right now, a majority of the testing we do is the PCR testing or the point-in-time testing that decides whether you have it or not. The antibody testing is available through the commercial labs. Now, it is in limited supply. It is expensive to get, and you have to have a lab slip from your physician or your medical provider to get that. But it is available, and you can get it at certain areas. And we are working to make that widely available in the future within the community, but that is not available yet. So we're still working at that PCR test, which is that point in time to make sure whether you're sick currently or not. So Dr. Fry, maybe you can help me with a little bit of context to that too.
Thank you, Commissioner Lissy. So yes, this is so rapidly evolving. I would really encourage everybody out there to really reach out to their physician and understand where they can get testing and what their options are in terms of cost and availability. And again, I can't stress enough, it's so important to have a conversation even prior to getting the test to really understand how to utilize the test results going forward.
All right. John? Nothing? Okay. I'm going to wrap it up, and I'm just going to ask our panelists that are here with me today to just say some kind parting remarks, because I know you will. And I'm going to start with you.
Well, I love the term COVID kindness. I think you've really given that meaning, and I think the kindest way we can behave towards one another is to wear masks and wash our hands and do all the things we probably learned in kindergarten. I do hope that everyone goes out and indulges in some curbside commerce. By that I mean looks at those stores and businesses that have been shuttered and closed and some that may never open again. Get online, buy the product whether you need it or not, pick it up curbside and help money flow again in this community.
Yes, great comments. Or buy gift cards too if you can.
Yes, gift cards are great.
I love it. Dr. Fry.
Thank you, Mayor Shivi. So I think everybody really understands that our economic success long-term is really predicated on safely opening and staying open. And the medical community, and I think the community at large, is very concerned about what the coming weeks look like, what they hold for us, and especially moving into fall, where we typically have influenza season start in October and November. And really this could develop into the perfect storm if we're not careful. COVID is powerful. We can't underestimate it. Those that have underestimated it have paid a heavy price. And if we have a COVID season coupled with a really bad flu season like an H1N1 about 10 years ago, that could really be very detrimental and potentiate another closure, which I think could just be disastrous for us, even more so than this first closure has been. Thank you.
That's why I really stressed how we conduct ourselves today will determine our future. And I know people are looking at the numbers, and I've had people say to me, oh, that doesn't look that bad. But also, if you've lost a family member to COVID-19, it looks horrific, absolutely horrific. So I want people to be really careful about that, but I also, a friend of mine who we go to the 1868 soccer games together, and many of you that know him from soccer and TMCC passed away, Gonzalo, wonderful, wonderful man. We will deeply miss him, but I think people need to understand it is incredibly serious. So again, thank you for those comments, because I want everyone to know when they look at those numbers, we're doing well now, but they could easily spike up, and that could cause, like you said, a massive storm. So I just want to stress that. Commissioner Bob Lissy.
Thank you, Madam Mayor. I really appreciate the opportunity of being part of this today and having this discussion. I think it's so important. And as we continue to move into our Northern Nevada's road to recovery, as regional leaders, our community, alongside of our governor, and we are working to keep everyone safe. But at the same time, we're trying to plan our future and our phased reopening and what that looks like. And I urge you to heed the warning. And this is a time to be vigilant, to make sure that we are doing everything we possibly can to keep our community safe, but still support our local businesses, get back to see your doctor, go to see your dentist. Make sure you're doing everything you possibly can to keep our beautiful economy viable. And I'm so proud that I get the opportunity to work alongside of the mayor and the city, the council members from the city of Reno, and the Mayor Smith, and the council member Sparks. As we move through this cohesively, we will get through this, and we'll continue to do so. And when we reopen and we continue to make those policies and how we're going to reopen, these are going to be important, as the mayor pointed out, that these directives were going to help us make sure that we open in the smartest way possible so that it's safe for our community and that we can get Nevada and Northern Nevada and Reno and Sparks back online and back on a global scale of what we once were, but in a new normal. And so I strive to please heed those warnings. Take care of everybody, use humanity as a guiding principle, and make sure that you're looking out for one another. Thank you.
Thank you so much. Great comments. City Manager Chief Soto. Chief Soto, City Manager.
Thank you, Mayor Sheehy.
Go ahead.
I'm just going to echo a little bit of what Chair Lucy said, and I really wanted to speak to our business community because I've had so much conversation with them, and I know that they're the lifeblood of our cities, of our region. And we are working diligently to find avenues and opportunities so that you can open in a very safe manner, so that we can get back to a sense of normal here in the biggest little city in the world. And our staff has been working diligently and on overtime, trying to identify these businesses and assist them in what that process looks like. So I just want our businesses to really hear all of us, that we haven't forgotten you. We know that it's been a long road, and we're going to get you back open.
Great comments. Fantastic. Dr. White, our dental savior.
No, hardly. First of all, I just want to say thank you so much for allowing me to participate today. It's an honor to go ahead and be amongst so many great folks here. And for me, I'm going to go ahead and probably close with two words that mean the most to me: community and communication. And when we look at this, much of what we have is a separation, and it's what's causing most of the fear. So through this, I've learned so much that communication is so vital, whether it's communication with your family, communication with your loved ones, or to us, communication with your patients, because the unexpected isolation that feeds into the fear. And then community. We can't do it alone. For many of us, we've been operating very luckily within our little bubble, quite successfully, and poof, it popped, and we were all by ourselves. And maybe some of us had really strong units. We collaborated well, and there were other of us that did not. And yet it's gone ahead and brought it back to whole. If we were fortunate to grow up in this community, we really relied heavily on our friends, maybe reconnected with people around the country in ways that we never thought we would ever again. And so through this crisis, there has been some unintended silver linings that I have truly learned, and I'm sure many of us can go ahead and sympathize with. But I think that it's not getting through this crisis, but taking those lessons forward and continuing to be a strong community, but also continuing to communicate well. And one last little parting thing that I'd like to say personally: although I'm a dentist by day, education is truly my passion. And I just want to go ahead and say to all the parents or the caregivers that took on the path of education and responsibility of Zoom calls and whatnot, I commend you. This is so admirable and such an unbelievable job. No, you guys were probably not prepared and suited, not suited, but prepared, but you have done a tremendous job. And no matter what, you've done an excellent job. There's been times where we can all sympathize with each other, where we've almost lost it or gone ahead and been more frustrated, but it's what we did at the end of the day that matters. And so our little ones, they will live to tell an incredible tale as we continue forward, having experienced this, and for several months went ahead and were homeschooled by their parents or loved ones, is going to be an incredible generation going forward. So I just want to say thank you to all the community, because guess what? You are the community leaders, and thank you so much.
Fantastic. Love it. Thank you. John, is Dr. DeMiro on the phone? I would love for him to give us some closing remarks.
I am here. Can you hear me?
Yes, thank you.
Excellent. Thanks. I'll keep it brief. First of all, I just thank you for getting everyone together. I think this has been very informative and educational for the public, but I want to reassure the community that we are dedicated to creating reasonable and safe solutions for the future of better health and wellness on a go-forward basis. So thank you so much, and we're working diligently to make this the situation as best as possible. Thank you.
All right. Thank you so much. And I want to just thank each and every one of you for being here with me today. It really means a lot. I know many of you are so busy because when I call you, right when it goes into voicemail, so I know what's going on. But I want to just say one thing. We would absolutely be remiss if we did not mention all of you high school seniors. We absolutely love you. Congrats to our senior class. I'm seeing so many great stories and people, sending these seniors gifts and things like that, but I can't even imagine how hard it's been on you and not to have that graduation that you're so used to. But I just want to say that from all of us up here at the dais, we are so incredibly proud of you, and we just want to say congratulations. You did it. So I want you to go outside, I want you to throw off that cap and gown, and I want you to tape it and then send those to the City of Reno. We would love to air them. So thank you, everyone. Have a wonderful evening. Thanks, and God bless.